In our lymphatic system, we have 9 lymphatic trunks. These are very large and long lymphatic vessels that collect lymph from a very large portion of the body. For example, from the entire one side of head and neck, lymph will be emptied into one lymphatic trunk, or from one upper limb and shoulder, lymph goes into another lymphatic trunk. And then eventually these lymphatic trunks, some of them join together to form lymphatic ducts. The main responsibility of lymphatic ducts would be emptying lymph back into the bloodstream. And the blood vessels that accept lymph are veins, which I'm going to talk about which veins are the ones that receive lymph. First, we focus on 2 jugular trunks. These are the ones that collect lymph from head and neck. And as you see, they bring lymph toward the upper part of the thoracic region. We have 2 subclavian trunks. They collect lymph from upper limb and shoulder and bring lymph again to the upper part of the thoracic region. And we have 2 bronchomediastinal. They drain lymph from the wall of the thoracic region and the structures that we have inside the thoracic region. Please keep in mind that we have some very important structures inside the thoracic area, including heart and lungs. So those are bronchomediastinal trunks that drain lymph from these anatomical structures. And as you see, all the 6 trunks that so far I talked about bring lymph back to the upper part of the thoracic region simply because the veins that are supposed to receive lymph are located in this area. Then we move down and we notice from lower limbs we collect lymph through 2 lumbar trunks. Also, lumbar trunks collect lymph from the wall of the abdominal region, the wall of the pelvic region, the visceral organs that we have inside the pelvic region, kidneys, which we know kidneys are retroperitoneal, and adrenal glands that are sitting above kidneys, tilting toward the midline. So from all these structures, lymph will empty into the lumbar trunks, and we notice that the lumbar trunks are taking lymph toward a section in abdominal area which is very close to lumbar vertebral bones. We also have 1 intestinal trunk, but before I continue, let's pay attention that all the other trunks that I discussed so far, we have a pair of each one of them. We have a right and a left. However, intestinal trunk is just 1 trunk. It drains lymph from structures such as stomach, spleen, pancreas, a very large portion of liver, and also from intestines. So all these structures, they empty their lymph into the intestinal, and I noticed that intestinal also takes lymph to the same spot that lumbar trunks are heading. Exactly in that area, we do have the beginning of the left lymphatic duct. However, before we get there, let's explain how right lymphatic duct forms. In most individuals, when we follow right jugular trunk, right subclavian trunk, and right bronchomediastinal trunk, we see that these 3 trunks near the junction of internal jugular vein and subclavian vein directly attach to the veins and empty their lymph into the bloodstream. So in most individuals, they do not join together. However, in a small percentage of population, these 3 trunks join together, and what they form would be a very short lymphatic duct that is called right lymphatic duct. And it's very short. It's about only 1.2 centimeters. So that would be the right lymphatic duct that empty lymph near the junction of right subclavian vein and right internal jugular vein. So when I look at this simple map, I notice that lymph from the right side of head and neck, from right upper limb and shoulder, and also the right side of the thoracic, empty into the right lymphatic duct. The rest of the body, lymph from these areas, will be emptied into the left lymphatic duct. So now I can go back exactly to where intestinal and the two lumbar trunks are heading, which would be a dilation that is called cisterna chyli. Cisterna chyli sits exactly in front of L2, lumbar vertebral bone number 2, and that's the beginning of the left lymphatic duct. When you follow the left lymphatic duct, you notice that most of this duct passes through the thoracic region. That's why we are allowed to name it thoracic duct. It's a very long duct. It's about 45 centimeters. And as you can see, exactly at cisterna chyli, which is the beginning of thoracic duct, we receive lymph from the two lumbar and the one intestinal. And when we go up, we notice that the left jugular trunk and left subclavian trunk also empty their lymph into the thoracic duct, and thoracic duct empty lymph into the venous system at the junction of the left subclavian vein and left internal jugular vein. However, as you notice in this image, I did not connect left bronchomediastinal trunk to the thoracic duct because simply this trunk does not attach to thoracic duct. Instead, left bronchomediastinal trunk exactly in front of left subclavian fuses to the left subclavian and releases its lymph directly into the venous system. So here we have a very simple map that shows right lymphatic duct, empty lymph at the junction of right subclavian vein and right internal jugular vein. Thoracic duct, empty lymph into the venous system at the junction of left subclavian vein and left internal jugular vein. And let's recall that left bronchomediastinal is not going to join thoracic duct. Instead, it fuses directly to the left subclavian vein. And we know that when internal jugular veins and subclavian veins on both sides join together, we have formation of brachiocephalic veins that take blood into superior vena cava, which releases blood into the right atrium of the heart.